We are moving from actual health services, which does like physician-to-physician connectivity for better patient care and information sharing, to Medcurio that does massive institutional enterprise-based information sharing inside major health systems. If you could, Doug, start us off with a little bit about Medcurio.
Well, it's a big breakthrough. It's incredible. So Stan, look, this is the first time in 25 years we've had to actually work together and scale companies. And we actually connected when my book eHealthcare came out in 1999. So with my futures work, I've always been right, and I've been always kind of wrong about. I've been right about what, and Medcurio is a what, and I'm wrong about timing. So I think Medcurio is going to be a new standard in data access for health systems. Now understand, it's not SaaS, but it is a tool for health systems to access all of their data in real time using 90% less time, money, and resources.
Yeah.
And I actually met Buzz when I was the innovation officer at the Innova Center for Personalized Health, and I was trying to find patients for clinical trials. Why did I have to sit next to a doctor and nurse looking for a female over 50 with diabetes and cardiac problems? Well, we'd have to put in a request to do those search variables. This is 2017. Search variables, and it would take 6 months to get the results back. It's like, I can't believe it. So that's how I actually met Buzz and then reconnected him last year.
And Doug is not kidding. Literally, this book is still on my bookshelf today in my office. It's called eHealthcare. It was published during the dot-com boom in the 90s. And when I was brought to Columbia to teach eHealthcare from Quinnipiac, there was nothing published about the dot-com boom. So this is my first textbook I had to use in my class. And all my students were wondering, why are we paying $110 for a textbook? And it was the best one out there. And I would recommend you buy it on eBay or wherever it's being sold still. It's a great book to look into. More of a history book now, but a lot of what Doug talked about in the 1990s, you'll see, was actually...
It's about service.
About coming through.
It's not about the web. It's about service and helping people who are sometimes patients heal and help care teams operate at the top of their license.
Buzz, talk a little bit more. You come back from more of an academic standpoint. You've been a leader in academia for decades. Talk about your inspiration for doing this, and then some of the misunderstandings that people have about interoperability within hospital systems.
Yeah, so I came into this, having spent 16 years, 10 at Geisinger, 6 at Sutter as a research leader. And I was really interested, actually, when I got to Geisinger to build the research center there, trying to use data in real time to automate. My initial interest was in clinical trials and trying to scale clinical trials in a large system, because I had just, my clinical trials company was acquired where we were trying to do that on scale. And after that 16-year journey, in 2018, my CTO and I looked at each other and we said, the software development framework is going to get easier and easier, where it's really just going to be about how good your idea is, because the translation of that idea into software is just going to get better and better. But it's never going to work unless we can fuel it with real-time data. Because if you can't do that, then the software doesn't work. So we said, let's stop working on the front end and let's reinvent interoperability for healthcare. And so that's what we did. And we did it in a way that I would say even today, and we've been at this for 5 years, is ridiculous in terms of how easy it is.
Yeah, and I think that's what everyone's so excited about. Anyone in here that works within a hospital system understands how important it is to have access to real-time data. That's not what we get today with the major inpatient medical record systems like Epic, like Cerner, et cetera, especially on the reporting side. It can take a week or 2 weeks to get reports on your own data going through their reporting systems. Talk a little bit about that. Where are some case studies that you can tell the audience today where this is making the biggest difference, and what's diffusing the fastest right now in the ecosystem?
Well, I think that I'll just make a point about electronic health record data and why it's so important to have easy ways to move it, because it touches virtually everything in healthcare, and whether it's alone or in combination with finance data or supply chain data or whatever, but it's almost required for almost anything we want to do. So if you want to automate any area of care, you've got to be able to easily move the electronic health record data. And the challenge is that It's expensive and very time consuming, and we have lots of data gaps. And I would say the signal that we don't really have a methodology is we've got lots of methods for you to use. None of them work very well. They're all difficult, and you figure out how to put them together. And I call that a workaround. And we heard there's HL7 FHIR APIs, vendor APIs. There's data extracts. We heard RPA. All of these things are trying to be used to stitch together some solution that is enormously expensive and difficult and fragile. And I had 16 years of that and decided that this is not going to work. And so we thought what we needed was a modern codeless API approach for electronic health records that allowed health systems to basically have full control of using their data in real time. My favorite use case is one that I think has lots of applications, and it's real-time dashboards. Because real-time dashboards actually are relatively easy to build today in Power Platform or Tableau. And if you had an easy way of powering those dashboards with any electronic health record data that you wanted, you could do amazing things. You could have bed unit risk management applications that are helping to the nurses in a bed unit to really effectively manage risk versus the way we do it today, or most systems do it today. They get a monthly or quarterly report on how they're doing. They've got to then figure out how they're going to fix what went wrong, and they got to put a team together to plan that. And I was in healthcare long enough to know that that method doesn't work. It just doesn't work, and it's not making progress.
One specific win from one of our key clients on one use case. So Medcurio can be used across all health system processes: back office, patient support, population health. One example: replace patient portal, replace the vendor APIs, of which there were toll charges. So essentially, data access fees. So that was $1 million a year. So with one use case, the health systems immediately saved $1 million a year, and they erased their data access fees.
And so, Buzz, talk to us. Why hasn't this happened yet? Why are we waiting now in 2025? We've had electronic health record systems for decades. We've had the modern day kind of level 9 EHRs for the last 10 years since the ACA. Why is this taking so long?
Well, I think that healthcare has evolved in a way where we have these tools like vendor APIs, and they're very fixed APIs. FHIR APIs, also fixed and standard. HL7 messaging, a way to sort of send data when there's an event. Data extracts. We have these methods because there's no easy way to get to the data. So we've used stuff that's been sitting around that was designed for another purpose, and essentially say to folks, here's your tools, and do the best you can. And that's the world that we're in. But it's become sort of quote standard. We've sort of say, oh, this is how we actually do it. And people don't look at it frankly and say, this doesn't make any sense. It takes too much time. We can't get the data that we need. Solutions often fail because if you can't get the data that you need, then you have automation sort of mixed with manual work. It's like having Google Maps, where if you couldn't get the data on retail places or businesses, you'd have to look it up yourself, right, and then figure it out. But that's the same thing in sort of healthcare. And I would say a huge pain point is any application that you try to put in production in healthcare to reduce work burden and improve quality is always going to have to be updated. You're always going to get user feedback. And the problem is it's very difficult to change the data. And because it's difficult to change the data, the change management process that we use is one where we try to get nurses and doctors to adapt to the application when the paradigm for this is to adapt the application to people's workflow, right? And so the failure rate's really high.
That makes sense. And Doug, we got about a minute left. Give us some closing thoughts on what we're in for. You've been literally future casting for decades now. Where are we all going with this?
Well, first is Salesforce is used in life sciences and health systems, but health systems can only use 5% of the capabilities that Salesforce has because they can't access data in real time until they are a partner and a client of ours. And Salesforce, Venue for Salesforce is in their App Exchange, and that will allow health systems to truly use the complete CRM capabilities of Salesforce for patient support, post-visit follow-up, referral management, scheduling, care coordination, care gap closure. The use cases are unbelievable. So it will be the new standard. The only question is whether it's 3 years or 5 years. And people have to recognize is the way they've been doing things is costly, inefficient, and doesn't work well, and it makes clinicians change their behavior. And when the tech needs to support the way people want to work in the most efficient way.
That's fantastic. Well, thank you both. We're looking forward to hearing and seeing good things from you in the fall, and appreciate you joining us today.
Thanks.